Okay, so what do these three things have in common? The three things are, in case you can't tell, this one up here is a kidney with kidney stones. This is a pregnant woman, I guess you figured that one. And this down here is a plane full of old people. So what do kidney stones, pregnant women, and old people on aeroplanes have in common? There is a clue in the fact that Batfink, here he is asking the question. So go ahead and pause the video there and see if you can figure out what do these three things have in common. When you've done it, just press play again. So the answer was, of course, ultrasound. Those three things have ultrasound in common. And here we've got the rest of this little video. So these are the objectives. This is what we're trying to learn. So number one, what is ultrasound and what kind of wave is it? Number two, what are some uses of ultrasound? And number three, what are the advantages of ultrasound? Pause again, have a read through those and check sure that you know what we're doing. Okay, so we'll carry on now and we'll talk about this first one. What is ultrasound? What kind of wave is it? So one last look at our objectives. So we know we've done everything we needed to do. What is ultrasound? Sound that is too high frequency for human beings to hear. That's above 20,000 Hertz. What kind of wave it is? It is a longitudinal wave. That means that the vibrations of the wave are parallel to the direction that the wave is going. And it has two identifiable features: compressions, where the particles are close together, rarefactions, where the particles are spread out. Okay. Second objective, some use of ultrasound, so scanning, sonograms essentially, removing kidney stones and measuring blood flow. Dead easy, pretty straightforward to remember. You might want to go back and check you understand how the sonogram picture is produced. We can talk about that more. And then finally, the advantages of ultrasound over X-rays. Two things, basically. X-rays are harmful because they're electromagnetic radiation, and X-rays can only produce pictures of bone, solid tissue. So ultrasound has neither of those problems, so it has that big advantage. Okay, that's it. So here we go. First bullet point, dead easy. Ultrasound is any sound that is too high frequency for humans to hear. This means it has a frequency above 20,000 Hertz. So you remember from way back in September of year 10, 1 Hertz is 1 vibration per second. So 20,000 Hertz, 20,000 vibrations per second. Any sound that is vibrating faster than that is ultrasound. Okay, because its pitch will be too high for the human ear to register. Okay, so if you're asked this question in an exam, it's essentially worth 3 marks. 1 mark for saying too high. Second mark for saying it's the frequency that is too high. And then a 3rd mark usually if you remember that it is above 20,000 Hertz. That's the magic number. Okay, so that's how we define ultrasound. So now a bit more complex. This bullet point says, because it is a sound wave, it is longitudinal. Okay, so what does that mean, longitudinal? Well, if you remember, most of the waves you would be familiar with are what we call transverse waves. There is a transverse wave. So light, gamma radiation, radio waves, they are all transverse waves. And you remember on a transverse wave, the wave will be travelling this way, but the particles would be vibrating up and down. Okay, so transverse wave because the vibrations are at right angles. So that is, the vibrations are at right angles to the direction of the wave. Okay, sound is different from that. It's a longitudinal wave because the vibrations, here they are parallel to the direction that the wave is going. Okay, if you imagine a person standing on this side of the screen, there he is, let's call him me, and he is speaking, and over here there is a large ear that can hear me. Okay, so the direction of travel of his voice, which is a sound and therefore a longitudinal wave, is that way. Okay, and as he speaks, all of the air particles between him and the ear vibrate backwards and forwards. Okay, so those vibrations, there you can see them, are parallel to the direction that the sound is travelling. So sound is a longitudinal wave. Okay, and you could see some features on the diagram. You can see some features of a longitudinal wave. Okay, so as those particles vibrate backwards and forwards, in some places they will get bunched together. So where the particles are bunched close together, we call that a compression. Okay, and where the particles are spread out, we call that a rarefaction. Okay, so bunched together is a compression, spread out is a rarefaction. And actually, longitudinal waves are sometimes called pressure waves, and we can measure the air pressure between the talker and the hearer. If we measured the pressure here, it would be a high pressure, lots of particles close together. If we measured the pressure here, we'd get a low pressure, particles less close together, more spread out. Okay, and in fact the pattern, as the diagram suggests, would go high pressure, low pressure, high pressure, low pressure, high pressure. Okay, so just to recap, ultrasound is any sound that's too high frequency for humans to hear, above 20,000 hertz, and it's a sound wave, so it is longitudinal. Remember the definition of longitudinal, where the vibrations are parallel to the direction of travel. Okay, and then the two parts of the wave: compression, where the particles are bunched together; rarefaction, where they're not. Okay, let's look at then. We'll carry on and we'll look at what ultrasound is used for. So here we go. First use of ultrasound is the one we all know, the sonogram. Okay, which just means sound picture, essentially. Here we go. I bet we've all seen one of these before. So this is a baby inside its mother's womb. If you look carefully, you can see that there's a hand there waving hello. There's its head, nose, see the outline of its skull in bright white. If you look down here, you can just see its spine there, and there's its belly there. Okay, and all the bits behind are the mother's womb. Actually, there's probably the bladder down there, and there's the womb. Okay, so a sonogram. How does it work? Dead simple. You, or the sonographer, that's the person who takes the picture, would send in a pulse of ultrasound. Okay, and when that ultrasound hits a barrier, such as a bit of baby or a bit of womb, some of the sound will be transmitted, some of it will be reflected. Okay, and then later on it will hit another barrier, such as a part of baby, and some more of it will be reflected and some more will be transmitted. And all that happens is the sonogram machine detects how much of the sound is reflected and how quickly it's reflected, and it sends that information into a picture. Okay, so it's just like you send a sound wave in and you basically record the echo, and the speed of the echo and how much sound is echoed allows you to convert that into a picture. Okay, dead easy. Right, let's move on. Next use of, so these things here are kidney stones. Okay, so as your kidneys do with their normal function, you get build-up of some of the minerals that are in your urine will start to build up inside the kidneys. Okay, and if you're unfortunate, they will build up so much that you get these little stones, literally stones. Okay, inside your kidney. There are three ways to get kidney stones out of kidneys. So number one is you have surgery and somebody removes them with a scalpel. Okay, quite invasive, possibly dangerous. The second way, okay, is, here's the word, to pass them. Okay, now if you've paid attention in biology, you know there is only one way from the kidneys to the outside of your body. Okay, so if you just imagine for a moment squeezing a stone out from the kidneys, out of your body. Okay, not a pleasant thought at all. But fortunately, ultrasound comes to the rescue, and this is really simple. Okay, so you have a very high-powered ultrasound producing machine. Okay, and and you focus a very narrow beam of ultrasound onto the kidney, and it makes the kidney stones just vibrate very, very quickly. Okay, and as they vibrate, they start to break apart, and as they break apart, obviously they get smaller and smaller and smaller, and essentially they just crumble, and you can then pass them out of the body quite comfortably without any pain at all. So, kidney stones vibrated using ultrasound, they disintegrate and you can pass them easily. So no need for surgery, no need for extreme pain. Brilliant. Right, last use. Okay. So, remember the old people on the plane? Right back from the first slide? Okay, well, if you travel on an aeroplane and you spend a long time on the aeroplane, you are in danger of getting deep vein thrombosis. That is where a blood clot forms in your lower legs, and that blood clot can come loose and it can travel to your heart or to your brain and do serious damage. So if you do develop a blood clot, one way of being able to trace it is using ultrasound. So very similar to the way a sonogram works for a pregnant woman. You just look at the vein. Here you go. So this is a vein or an artery, and we can detect a little clot there, and actually a tiny little one there as well, using ultrasound. And here is another artery, and you see it's a lot brighter, which tells us there's a lot more blood flowing through, so that's a healthy one, and that's a less healthy one. So, third use, measuring blood flow. Okay, so we've looked at what ultrasound is, we've looked at why it's a longitudinal wave, we've talked about what the use is, and then the final bullet point that was on our objective slide was, why is ultrasound better than x-rays? Well, if you look at the top picture, this one here, okay, that is, quite unbelievably, an x-ray of a pregnant woman. Okay, so what can we see on this picture? Well, if we look closely, here we go, you can see this is the mother's pelvis, this is the mother's pelvis, this is the mother's pelvis, this is the mother's spine, this is the mother's hip and femur, hip joint, femur, and you can just about make out a bit of baby's head there. Okay, so we go back to our slide, there we go, let me put it in the right place. Okay, clearly x-rays only show bones. Okay, what good is a picture of a bone if you want to look inside a pregnant woman? Okay, so one advantage that ultrasound has is that it can show soft tissue. Okay, if we look down here, we can see womb, even placenta to some extent. We can see all the various parts of the baby, whether it's bone or muscle or fat or heart tissue or even brain tissue, whatever it may be. So advantage number one, ultrasound can show soft tissue as well as bone. And of course, the other great advantage, okay, this is a shockingly dangerous thing. So you remember that X-rays are electromagnetic radiation, and they are right at the top, almost into gamma rays, okay, which means they're carrying a great deal of energy. So X-rays will do an enormous amount of damage to living cells, particularly the undifferentiated cells of a developing fetus. Okay, so second big advantage, X-rays are electromagnetic radiation and are very harmful to living cells. Ultrasound will do no damage at all. Right.